Mental health workers are taking action today due to the pitiful offer that the Victorian government offered them yesterday. We have been offered a 2% pay rise per year over the next 4 years, which puts us substantially behind the general sector. It's not good enough. These members have been working day and night throughout COVID, where mental health of Victorians has peaked. We're working with full acute wards, we're working with full EDs. They haven't had a pay rise since April 2019. Enough's enough. They deserve respect from the Victorian government.
This offer is not good enough.
I've been a mental health nurse for 34 years in Ballarat Health Services. Yesterday we got a reply from the government for an EBA which is 18 months in the making, which is absolutely ridiculous.
I've come out to support my other mental health workers. I've come to send a message to the government. They're not listening to us. We're the largest workforce within the mental health service, and we should be listened to.
So I'm a registered nurse on an inpatient unit. I've come out here today to protest in front of James Molino's office because we're 4 nurses short this afternoon. That means that I have to sign up for a 15-hour shift to make sure my patients get the care that they deserve and that they need.
Mental health, support us now! Daniel Andrews, government, I want you to notice we're nurses from the Northern Hospital, psychiatric nurses, and we need you to sign on the EBA. It's been 18 months and we're still waiting.
We're mental health workers from Austin Health, and we're here today at Anthony Carbine's office to send a message that mental health matters. It's been 18 months and we've just received an insulting offer that leaves us worse off compared to our colleagues in the public health system. We need a fair deal now.
Yeah.
Mental health, support us now! Daniel Andrews, support us now!
We're mental health workers at Thomas Hamlin Hospital, and we just like to say in one voice that we are absolutely disgusted with the latest offer from the state government.
Well, I just think it's really sad that the government doesn't believe that we should be paid as much as general nurses are. When we're a specialised area, we deal with some of the most vulnerable people in the community, and we spend a lot of our time dealing with people on their worst days.
I'd like to thank all the members today for taking action. The mental health offer we received is an absolute disgrace. It does nothing for wages, nothing for recruitment and retention. It does nothing to fix the workforce shortages. It does nothing to support careers. It's an absolute disgrace. They say that the system's broken. Well, they continue to break the system. They say the workers are the heart and soul of mental health. Well, how about you actually look after the heart and soul and get this system fixed, fix up our EBA. The members have had enough. They want to do their job. Just get it done.